So just wanted to know, starting out with like how is your day, a day in your life like as I know you're a pathologist, but as far as radiology is concerned, which is part of the pathology field. So what would you say as far as radiology related, how your day in life is like?
Well, for radiology, just a little background. So radiology was covered all under the specialty area of pathology. It used to be pathology, radiology, and oral medicine. And so eventually because radiology became more extensive with the different types of radiological tools, it became more advanced, and so they separated out and was able to establish their own specialty program.
Okay.
So with that, pretty much what happens as a radiologist, you will look at Panorex, the more popular radiographs that we use in dental practice, some PAs, some bite wings, but those are small. It's easier for the general dentist to actually use those. But the Panorex, it's more extensive. And then we started using things like CT, and one of the CTs we started using was cone beam CT. So you'd hear a CBCT.
Okay.
And so what ends up happening is a lot of times, and now we've gone digital, so what happens is somebody will send a case of a patient who basically says, I have this issue, and it was referred from a doctor. The doctor would say, I have this CBCT or I have this radiograph, could you please help me differentiate what this may be?
Okay.
And so radiology does not diagnose, but they have good indications of what this may be. And so after they give their description of the radiograph, then we'll go ahead and send it out for either a general referral or say, based on what we see, it's more likely to be this, and this will be the potential treatment level. So we get anywhere from 50 to 60 radiographs a day, and if we're doing CBCTs, we may get about 25 of those. And we have to read them. Reading them means that we have to diagnose everything that's on them, and then give a note and prescription information on that. So that's pretty much what happens.
Okay. So you're more in charge of like the diagnosis compared to the radiologist who will look at the radiographs and kind of give a general idea of what they see in the radiographs, right? And then you would go ahead and further diagnose the radiograph.
Right,
and
based on they'll say this will be new further evaluation through a biopsy, and the biopsy will then be read out by the pathologist.
Okay, gotcha. So someone who has a desire to become a radiologist / work in the field of pathology, what advice would you give them?
Oh, for radiology specifically?
Yes.
The best thing to do with that is, first, it's the quality of life. What are you looking for? General dentistry is labor intensive. You're sitting there doing surgical procedures day in, day out, 40, 50, 25 to 30 patients a day. And so it can get very intense and your back hurts. But radiology is one of those where the quality of life is a little less intense. You see a number of radiographs, you'll go and do some clinical evaluations, you'll go and teach other doctors kind of what to look for based on a CT, an MRI, a CBCT, arthroscope. I mean, the variety of different radiographs that are out there.
So you see a lot of cases.
You get trained on all of those, and then you will then be able to go and help evaluate patients based on that and read those out so that the doctor can then take that information and figure out what the next therapy will be.
Okay.
So, yeah, it's a great area. It's 3 years of education after dental school.
Okay.
And then you will then sit for your boards, and after you sit, then you become board certified. And then you go out and work with a lot of dental practices where you start your own practice looking at CBCTs, because that's more what people are needing most help in now is the cone beam CTs, because you can have full head CBCTs or just localized frontal areas, so the maxilla to mandible, or you can have from the cranium to the chin to the neck. And that's more extensive because you got to look at things like the sella turcica, you have to look at the temporomandibular joint, all the sinuses, the conchas, the occipital bone, because CBCTs can be three-dimensional. So it can be very extensive. And so for a general dentist to want to be able to read out their complete CBCTs or their Panorex, maybe a little bit more extensive, rather they just want to sit and actually provide the work. So they will refer that out to the specialist, and as a radiologist, it's a good quality of life.
Gotcha. And I'm like, based on what you're saying, I'm getting a hint of how maybe this field is also very research intensive, because of like the different techniques that you apply and the different advancements that you make.
Well, most radiologists are or radiology are associated with an institution. They're usually associated with a school.
Right.
Or a hospital-based center. And so because they're associated with that, there's going to be that aspect of teaching, and then there's going to be some clinical role, and then there's research. And so
Right.
the research will be looking at different levels of intensity.
Right.
So if you wanted to learn more about that, there's actually a good journal, and it's called O. And O is oral surgery, or pathology, or radiology, and endo, I think, is still a part of it.
Okay, very nice. Did you guys want anything else to be asked?
No.
Great. Okay, thank you so much, Dr.
Okay,
Ferguson.
you're
Really
so
appreciate
welcome.
it.
All right.
Thank you.
All right,
Good
thank you,
one.
Dr.
Thank
Ferguson.
you.